Hey everyone, welcome to Product School's webinar on how to approach UX for health tech products. My name is Anu, and I'm a product manager currently at Samsung Health. Over the last 5 to 7 years, I've spent time working at various enterprises, primarily in the digital health space. And if you ask me what motivates me to be in digital health or health tech, however you want to call it, first and foremost, it is a pretty strong innovation hub in the sense, there's so much innovation in terms of technology, services, and processes going on in the space. Especially as you can imagine in recent times with COVID-19, there's been a lot of game-changing technology in the space to help people improve the quality of their lives and help combat this disease. Um, and the space also presents tremendous learning opportunities, which sometimes might seem like challenges, but they're also very unique to the space of digital health. And last and final is that, everything that I do in the space or anybody sort of does in the space of digital health ultimately helps save lives. And I think that is a very enriching feeling, and that's something that keeps me motivated to stay in the space. All right, let me sort of set the stage for the rest of this webinar. So first of all, I want to give you guys an overview of the health tech industry. And this is primarily for anyone who, has not had experience working in the space or is maybe not as much familiar with what the space is all about. I'll then move on to talking about product management in health tech. And this is specifically going to cover some of the unique constraints that apply to product management in the space of health tech. And then finally, I'll go into sort of the meat of today's discussion, which is going to be how to approach UX and what are some unique strategies that are specific to designing health tech products. All right, let's get started. Okay, so first of all, what is health tech? So I really like this definition of health tech because I think it covers sort of, the end-to-end of the space. So health tech is the use of technology to improve the delivery and consumption of care. So what this means is essentially, health tech companies are essentially providing technology, which could be either wearables or medical devices or sensors and things like that, to basically help organizations that are already doing a pretty great job delivering patient care and essential healthcare to people. And this could be hospitals, pharmaceutical companies, insurance providers, so on and so forth. This is also a very heavily growing industry. It's valued at $8 trillion US dollars. And it's also growing pretty rapidly at 22% compound annual growth rate. And if you think about what's really driving the adoption here, I think it comes down to a few reasons. So first and foremost, behavioral trends. So people are getting more aware about their health, especially in the recent times. People want essential ways to bring healthcare in their fingertips and be more aware. There are also changes on the regulatory and policy side by leading organizations like FDA, which are really trying to sort of expedite the process of bringing technology products to market in the space of health tech. All right, so moving on, what does it take to build high-value, successful digital health products? So I want to look at it across three specific criteria. So these are essential criteria that apply to like any product management position or any product manager's role in any technology organization. But I want to point out some of the constraints that are pretty unique to the space of health tech or digital health. So first and foremost, on the user side, when you're designing health tech products, you're often solving for a lot of different user types and personas. It's rarely the case that you're designing a product just for patients or just for physicians. And it's typically an integrated system that involves multiple personas and multiple users who are engaging with your product. And you think about usability in the space, often this comes down to things like user error. So how are you designing products that essentially reduce the likelihood of people making mistakes, which might ultimately cause harm to life? And then finally, how are you driving outcomes for users? And this is essentially where we measure value in terms of, what's the value that a patient or a physician is going to get from using a product like yours? Is it, improving their condition? Is it making them more efficient? Things like that. On the technology side, there are a few considerations. So you have, regulations. For example, organizations like FDA might set certain criteria or certain limitations that might apply to technology products that are launched in the space. You also want to think about interoperability. So a lot of health organizations already use pretty rather outdated software that have been around for several years. And so when you're trying to introduce new technology, how is this essentially integrating with what's already out there? And then lastly, you have go to market. So, right up front, you want to be able to determine if you're designing a direct to consumer product, which somebody might be buying off the shelf or as an app that they can just directly download on their cell phone. Or are you designing a B2B or an enterprise product that you're going to go sell to a physician or to a hospital or an insurance provider? Because, that can dramatically change your constraints from a product point of view. And then ultimately, you also want to determine like who's paying for this product. So, is this something that a consumer is going to essentially spend money out of pocket and pay for it themselves, or are they going to rely on their insurance providers to sort of cover the payments or the cost of this product? All right. So, what are some typical UX inputs that go into designing health tech products? So, I want to sort of look at this across, some of the UX considerations that go into building typical B2C consumer tech products, as well as call out some of the unique constraints that apply to health tech products, whether these are B2B or B2C products. So, as you can imagine, some of the common inputs that go into product development can be user research, the voice of consumer that can come from like qualitative reviews, or surveys or feedback from interviews and things like that. You also have analytics, which is another big data point into getting inputs to developing your product. User research, VOC, analytics, all of that apply to health tech products as well. But you also have additional constraints that sort of uniquely apply to the space. So I want to discuss that briefly. So first and foremost, you have clinical needs. Oftentimes that becomes a very big input to designing health tech products. And clinical needs can come from your end users. It can come from the specific disease market that you're going after. For example, if I'm designing a product for the cardiac conditions versus pulmonary conditions, there could be a lot of clinical data points that differ between the two type of disease markets. You also have product integration. So as I mentioned, when you're designing health tech products that consumers can use to track, their heart rate data or blood pressure data, oftentimes, they're also using other products like blood pressure cuffs or, weighing scales and things like that. So if you're designing a new product for adoption by patients, you want to be thinking about how that product might integrate with existing technology and existing products that might already be used by patients. Thirdly, you have FDA design control. So these are some of the unique considerations that are set from a design perspective by regulatory organizations like the FDA, which often needs to be abided by or essentially incorporated into your product when you're designing health technology products. And then lastly, you also have engineering constraints, and these might come down to things like the use of Bluetooth technology or LTE, and some of those nuanced technologies that bring some constraints with that. For example, like syncing of data in a timely manner, onboarding and setting up and things like that. So I believe all of these aspects have a pretty high impact on the UX of a health tech product. So as a product manager, before you design a product and solutionize something, you want to first understand who your users are, what are their needs and pain points, and then what might be some product considerations that come from there. So to start off, I want to kind of call out some three broad categories of users that typical health tech products are designed for. So first, you have patients who are essential consumers of the product. They're typically the people who have a disease or a condition that we want to improve through technology, or essentially create a product that can help them monitor their vitals and things like that. The next group you have here are physicians, and I'll get into more details about some of their needs and some product considerations that come from there. But I also want to call out that besides patients and physicians, there's another big group of professionals in the medical space that are also very important. user types to consider, and these are like your medical staff, your cardiac technicians, nurses, so on and so forth, who are actually out on the field on the day-to-day basis, like interacting with patients, taking orders from physicians, and really like integrating with your product on a more tangible level than even patients and physicians in many cases. So I do want to cover some of their unique considerations as well. All right, so let's start off with patients. So, first and foremost, I want to kind of call out that, this is, you can't generalize this demographic, but typically when you design health tech products, especially when they're going after, a specific disease market, they tend to cater to people from the elderly demographic. So oftentimes you're designing products for people who are over 60 years of age, typically fall under, the silent generation or baby boomers. And why does this matter? And this matters because, as I mentioned, if you're going after disease markets and if you're designing products specifically for, pulmonary rehab or, cardiac arrest and things like that, like, those kind of diseases or, conditions really manifest more in the elderly demographic. So right there, they are more disease-prone group to kind of go after. They also have unique challenges with access to healthcare. So basically, think about physical challenges that elderly folk might have in terms of, getting out into the car and driving to the hospital to get access to healthcare or to get access to treatments. So, that's another sort of big pain point that's driving a lot of technology and remote patient care in the space. And it's also a growing demographic. So if you look at the chart here, this is a projected growth of this segment in the next several decades. And as you can see, it's a pretty rapidly growing demographic. So clearly, this is, a place that has a high amount of reach, but it also has a lot of depth in terms of the kind of, conditions and comorbidities that people in this demographic have. All right, so I want to illustrate sort of what, some of the unique personas that people in this demographic tend to have, because I realize that not all technology products are designed for the elderly. And so this is a fairly, unique segment to design technology products in general. So the first kind of persona I have here is a person called Bill Martin. He's 78 years old. He lives in a fairly, suburban neighborhood, which is Portsmouth in New Hampshire. He's a retired postal worker. He eats bacon and pork belly every day. He uses a walker, and he's also subscribed to Medicare insurance, which is, the government-funded insurance. And he also recently underwent CABG, which is essentially coronary artery bypass surgery. So this gives you a sense of, his lifestyle and sort of his professional and personal habits. So somebody like Bill is essentially, he's a slave to his bad habits. He is also old. He lives in a suburban neighborhood. So, definitely access to technology might be fairly limited in those areas. So, and on the contrary, let's look at another user here. So we have Vlad, who is essentially another persona that is a little bit contrasting from Bill. So Vlad is 63 years old. He lives in Austin, Texas. So this is, a relatively more urban city. He's a retired IT professional, and he trades stocks at home full time. He uses his iPhone to monitor stocks on the go. He's also subscribed to private insurance. So this also means that he has, greater access to healthcare, and potentially he may not be as inhibited by costs. He's also a smoker, and he suffers from a chronic obstructive pulmonary disease, also known as COPD. So if you think about Vlad as a person, he's also old, but he's relatively more tech savvy than Bill, just because of his prior professional experience and the fact that he continues to be engaged with technology by, monitoring stocks and kind of doing his thing as part of his retired life. And so, I think it's interesting to call out some of the, unique insights that we can derive from two pretty contrasting personas in this age demographic. So for someone like Bill, his habits are really difficult to break. And so he would much rather essentially take advice from a human specifically, his doctor, rather than being told by an app or some sort of a wearable or something that he needs to exercise or get his diet together. So for someone like Bill, when we design applications from a UX point of view, we want to make sure that we're increasing physician touch points within the app. So how can we create interactions within the app or features within the app that essentially allow physician engagement? This could be like, through personalized video chats or nudges or, direct communication with Bill's physician. On the contrary, for someone like Vlad, he's relatively self-motivated, and that kind of comes from the fact that he has been, in the IT space for a while. He's pretty adept with technology. And so somebody like him essentially wants timely and detailed information on his health and his progress. So for someone like Vlad, some of the considerations we might want to have from a UX point of view is how can we design detailed dashboards, more enriching data that can allow him to track progress and essentially keep track of his health. Somebody like Vlad would also do well with things like haptics and notifications to let him know when information is available, because he's kind of on the go and he's always looking to get real-time insights to track his health. All right. So now that we have a sense of kind of the personas we're going after, I do want to spend a second to talk about some design principles and associated considerations that specifically apply to designing products for the elderly. So first and foremost, I think one of the big design principles I like to swear by and have my team swear by is clarity. So how can we design applications, whether these are mobile apps or wearable applications or even a hardware device? How can we design applications that are really clear for end users, specifically in the elderly demographic, to easily understand and adopt? So some considerations that stem from there could be things like having larger font sizes. I think this is a no-brainer, and you can imagine like elderly folk having difficulty to read smaller text. So definitely think about how you can enlarge text sizes within the app. Also think about using text over icons, symbols, and colors. So this is just because, things are way more clear when they're in text form, rather than while icons and symbols might appear cooler or might, create a sense of an artistic sense within the app. It also causes a lot of confusion for people who are maybe not as familiar with common iconography. Thirdly, you also want to consider using higher contrast ratios, and this comes from an accessibility requirement where people in this age group might tend to be sort of colorblind or sort of partially or completely colorblind. So how can you create an application that has higher contrast ratios that makes it easier for people to see different patterns? And then lastly, having clear navigation indicators. So this is something where essentially, how do you allow a user to easily go back and forth to different pages within your app or navigate through different screens within a wearable without having to really press too many buttons or search too much within the screen to find something to go back home. All right, the second design principle I like to swear by is repetition. And this comes from the fact that, while people might have a steeper learning curve in terms of adopting new technology, people in this demographic are also fairly quick learners, and they swear by repetition. So like when they get used to a certain pattern or they get used to a certain, interaction within the app, they tend to want to see the same patterns kind of showing up over and over again. So, based off of that, you want to have consistency on interactive modules and try to see how you can repeat those tried and tested patterns all over your application to make usability much easier. Thirdly, I think this is also a no-brainer, but you want to create applications that take the least amount of effort to essentially use. And this applies to pretty much like any demographic you might want to design products for, but specifically for health tech products within, specifically for this age demographic, you want to think about how are you creating applications where the chances of creating errors within the app are low. Because you don't want people to, essentially press the wrong button or essentially, try to take a reading of their blood pressure, but then essentially make a small mistake, which has them having to repeat the whole process from the beginning, because all those things can cause a lot of confusion and frustration and take a lot of time. Along those lines, how do you also create products that are compatible with assistive technologies that might already be offered by products like your iPhone. The last design principle I just want to call out here is stability. And this is essentially, how do you create an experience for people which is stable and not something that's causing a lot of unnecessary alarm or unnecessary stress within the application. So something I like to think about is, how do you create an experience where you're minimizing the use of triggers within the application unless it's absolutely necessary. So I think folks who are typically younger and more used to technology applications might be less sensitive to things like haptics and notifications and triggers on their apps, because they're pretty used to that, and they're not as sensitive to thinking, oh, something wrong happening. However, the elderly demographic tends to be more sensitive to things like, oh, my phone keeps buzzing. Does that mean something was wrong? Does that mean I need to do something? So, those are some of the stress factors that kind of are caused by creating unnecessary triggers within applications. And you also want to think about how you're creating actions within the app that don't take as much time. And for example, you don't want to have something like a timer, which during the onboarding process, which might essentially cause a lot of stress for the individual to essentially complete the process really fast, and therefore essentially increase the likelihood of making errors. All right, so so to summarize, from a patient's point of view, to just put two kind of their big needs up front here. So you definitely want to create applications that are easy to use, and they also are looking to essentially create behavioral changes through either touch points with their physicians or through real-time insights and data. So product considerations that might stem from there. You definitely want as much clarity within the application as possible. You don't want to create unnecessary triggers, and you also want to think about effective motivations. All right, so let's move on to the physician user category. So physicians are typically the people who administer care to patients. They are typically the first line of defense for patients. And think about it, like if you have a health condition and it's getting worse over time, like you definitely want to go talk to your physician as the first line of defense, right? So so if you think about physicians as the user type here, they're also people who essentially end up being the first sort of folks that a company would have to essentially convince about new products that they might introduce. And this might apply more for enterprise products that you're trying to sell directly to hospitals or physician practices. So what are some needs for this user type? So first of all, they are looking for products with really short learning curves. So if, think about the physicians day to day, and they're already bombarded with a lot of things like taking care of patients, doing protocols, and learning and continuously improving upon themselves. So they already have a really short amount of time. So you want to design products that are easy for them to come up to speed on. You also want to create products that have high amount of clinical efficacy, because think about a physician and why they might be subscribing to your product. Maybe because they want more insights, or maybe because you have better algorithms that can do better detections than a traditional product that they're already using. So they're looking for ways in which you can prove that your product has higher clinical efficacy than an existing product that they might already be using. You also want to design products that are, that have low costs and have high outcomes. And as you can imagine, hospital practices are extremely cash sensitive, so they're not going to be investing money in a product unless they believe that it can have a high amount of outcomes on physicians and patients. So some product considerations that come from there. You definitely want to think about products that meet regulatory standards if that is so desired of your product. So a lot of products might, especially if they have to do with like tracking health information or sustaining life, they might potentially be they might be they might have to go through things like FDA clearance or FDA approvals. And so you want to definitely have those things in place while you're trying to sell these products. And then how do you show clinical efficacy? So this is something that you can potentially add to your product by running clinical trials, or essentially running studies where you can gather clinical evidence which can be proven to show that your product works better than what's already out there. And then reimbursement is another important consideration for physicians. So the first question they're going to ask you from a monetary point of view is like, do big insurance providers cover this product? Like, is Medicare going to cover it? Otherwise, like my patients are not going to pay out of pocket for a product like yours. All right, and then lastly, you have your medical staff, and these are essentially everybody who's not a physician who's engaging with your product. So this could be, nurses or ECG technicians. And if you think about their needs, they're already also stretched pretty thin in terms of their day-to-day workload. So you want to be creating products that essentially reduce the workflow burden. You also want to optimize for efficiency so that they can get more things done in less amount of time. And ultimately, the medical staff and other specialists are also looking to create value for their patient and physician. So how are you as a product manager incorporating aspects in your application that can make this obvious for them? And so some considerations there from a UX point of view is to have fewer steps, lower error rates. And another thing is from a UX point of view is to also think about how can you effectively train your users when you're designing products. So for example, at Samsung, I have my UX team spend a lot of time creating collateral for our end users in terms of training material, reference guides, videos, and things like that that help them easily absorb information and easily come up to speed on our products. All right, I also want to quickly touch upon some testing and research approaches, which are not just unique to health tech, but are pretty unique to any kind of product that you're designing for a niche audience. So specifically for health tech, as I mentioned, because our usage demographic is very niche, and we're going after like typically elderly people who have disease conditions, finding access to these test subjects can be really hard. For example, think about if you want to get access to 50 patients who have previously had a cardiac condition and are also not tech savvy. Like that's a pretty niche audience to go after. So finding access to people who might fit in that demographic tend to be more challenging. And so this is especially when you want to be really careful about using proxies. Like for example, I don't want to be running a test with healthy 25-year-old individuals and getting feedback from them and using that as a proxy to actual end users who are totally not fitting in that demographic, because that feedback can be really misleading and you could make some really bad product decisions based off of that. So yeah, I also want to point out some approaches to how we can get access to user subjects, given that these are fairly niche demographics. So some things that we've done in the past, some quick and dirty approaches have been trying to find research subjects in their natural habitat. So we have had instances in the past where we've had to run go to coffee shops or grocery stores and essentially find elderly folk and interview them and see if they would essentially fall under our target demographic, and then potentially ask them if they would be willing to test out a quick feature or a quick guide or something like that to essentially see how the product is doing. And if you think about it, these are very like low fidelity approaches to essentially getting access to our test users. Another thing that we've done in the past is creating a customer advisory council. So this is something where you essentially have a specific a set of users kind of go through your product experience from an end-to-end perspective. So you literally like give them your product, whether it's a smartwatch or an application or whatever that might be, and have them use it like a real patient. And then, based off of their experience and stuff, you can create personas that kind of map to different usage behaviors. And then every time in the future you have a certain product improvement or a feature you want to test out, you already have a vetted set of user subjects that you can go back to and, consult for feedback, rather than having to start afresh in terms of finding new people, new participants to test this product out with. All right, that's all I had for today. I'm happy to answer any questions. Feel free to type it in the chat box and I'll do my best to reply. But yeah, thank you so much for tuning in today. Hope you all stay safe and stay well. And yeah, look forward to seeing you again in a future webinar. Thank you.